Hello, everyone. My name is Thoryn Stephens, and welcome to the Brain Fitness One podcast. I am so excited to have here today a very special guest, a longtime friend of mine, Dr. Galen Buckwalter. Dr. Galen is a world-renowned AI scientist, beginning with a background in research psychology and a chief scientist officially at eHarmony. And then the role at Brain One as a Chief Brain Futurist. And we are absolutely excited about having him here today and really talking about the future of brain and neurological optimization. Dr. Galen, how are you doing?
Always a good time when I get to hang with you, Thorn.
Well, thank you so much. We've known each other, I guess it's going on decades now.
Yeah,
I was a young digital analyst working in e-commerce, and you were at eHarmony, and
yeah,
remember some of those first interactions. And it's interesting to note as well, you guys at eHarmony, you really were leading the charge doing production level machine learning and AI, before anyone. And I think the statistics around that are pretty incredible, Galen. I think you guys were what, marrying hundreds of users a day at one point in the United States, I think at
yeah.
your peak.
Like 230 or something a day.
Okay. Yeah.
Yeah, it was humming for quite a while. And
Yep.
there was a large scale research study done on it that
Uh-huh.
like a 7 year success rate and the divorce rate for eHarmony marriages was about 4%. Um,
Right.
Match was around 8, and
Okay.
the wild was about 11. So, I mean, there, yeah, as a good scientist, I have to put all the qualifications on that, and they maybe our sample
Mm-hmm.
was different in who we recruited onto the site, but I still feel pretty darn good about the stat.
Pretty incredible. Yeah,
Yeah,
my background in behavioral research, generally you're looking, most short-term metrics are looking at things like conversion rate, and then the better metrics are looking at things like customer lifetime value. Uh, and it's interesting, you guys were not just looking at something like, the immediate match, but further the engagement, the marriage duration, much longer term metrics that really denote success. And you guys were quite successful at that. So that's a really
absolutely.
interesting, component that you guys were really ahead of the curve. You were using, production level machine learning. Is that accurate? Do you want to maybe just give a quick overview of what that looked like at the time?
Yeah, we had actually done like 3 years of research before we even launched
Uh-huh.
to validate the questionnaire. And we came up with our algorithm based on what predicted marital satisfaction.
Mm,
Then we made the assumption that if we could match folks for long term marital satisfaction while they were singles, that at the very least we would avoid the total mismatches because I think that's what we honestly really wanted to impact the most with because you talk to any therapist and that works with couples and they will tell you there's a certain percentage of couples that come in that they can't do anything for. They're just fundamentally mismatched.
right.
So we had that um, algorithm that would give them a estimated marital satisfaction score and would limit the matches that were presented to them to ones that were above a criteria of, as I recall, is around 80% likelihood of long-term success.
Mm-hmm.
And so that was our fundamental model. And the the tech folks, built that all out in the cloud, and it was, you know, it was painful to get it up and running because it was doing that level of real time kind of.
Computation. And what year was that, Galen? I mean, this is
We launched in 2000. So
2000. Okay. Yeah. I mean, when I met you, I think it was about 2010.
yeah,
Yeah, absolutely fascinating. And given your research background, you have been focused in psychometrics for, the mainstay of your career. Were psychometrics integral into the matching algorithm back then? And, how do you see psychometrics having developed since?
psychometrics were absolutely essential.
Can you
The
define that for the audience?
Yeah,
Sorry.
psychometrics is basically the science of quantifying latent human traits. So to unpack that a bit, um, we all understand that we have aspects, about ourselves that exist, but we can't like put our finger on it. We can't put our finger on things like openness or a level of honesty, personality traits, values, but yet we know that there's a construct there. Psychometrics is kind of a combination of mathematical, statistical, and logical approaches to basically be able to validly reach the conclusion that if it looks like a duck, it quacks like a duck, you got a duck, or you at least have duckiness. That's a fairly arduous process to do it right. But at the end of the day, that instrument is going to be kind of capturing that ethereal construct
Hmm.
the same way, for the same person over time and different conditions. Um, so that we did a really thorough job at validating the eHarmony questionnaire. Um,
How many pages was that? Remember it being quite
oh,
long.
oh my God, the initial survey literally was 400 questions.
Oh my God. Yeah.
Yeah, and I was just adamant that, oh, we need, you know, the highest reliability. And,
Hmm.
but, you know, in a weird way, I think that initially kind of that barrier to entry served a functional purpose for us.
Hmm.
Because if you remember dating sites in 2000, they were not the type of environment that women wanted to hang out in. I mean,
Okay.
because it was just, you were being bombarded with pictures that you probably didn't want to see.
Yep.
There was very little screening and
Right.
filtering of content. So along came eHarmony, and to even get a match, you had to take a 400 item
Hmm.
questionnaire.
Right.
So, put it in the vernacular, it kind of kept some of the riffraff out. Um,
Yeah. That's
and
interesting.
um, and I think that helped.
I remember I was chatting with one of your colleagues, Dr. Steve Carter, and this is when I was dating. It was probably like, I don't know, 2012-ish. And, I had a good relationship with Steve. And I was like, Steve, have you seen this whole swipe thing with Tinder? And he's like, oh, yeah, it's just a fad. It'll never ultimately become a thing. And of course, in many ways, it actually became the, most, I would say, at least accepted form of meeting people is literally through swiping, swipe right, swipe left. And you
Yeah.
guys really pioneered that, and then I think it got really oversimplified, which I would assume would only lead to more matches that maybe are not the longest term, but certainly didn't go anywhere. But
Absolutely.
Okay. So shifting gears for a second, love to talk about your current research and those lovely PEDs that you have three on top of your skull, and really the future of brain optimization through BCIs. BCIs being brain computer interfaces. Of course, Neuralink gets a lot of the press, but there are companies like BlackRock Neuro that have been doing this research for decades. My understanding, you have 6 of the Utah array from the BlackRock Neuro, but would love to hear your story and ultimately close on the current research that you're doing, which is absolutely groundbreaking. And also further, just to let the audience know, Dr. Galen is the most connected human currently on the planet. Is that still true, Galen?
Yeah, and I have connections in the widest
Okay.
kind of range of sites in my brain.
Right.
I
And you said, yeah, go ahead.
specifically, I have an array in my dorsolateral prefrontal cortex,
Right.
which at this point, there's no other person that has a chronically implanted array in prefrontal cortex.
Prefrontal. Yeah.
And that,
Amazing.
prefrontal is kind of where the good stuff happens,
Yep.
um, where our executive functioning
Of
occurs.
course. Yeah. And so a total of 6 arrays, 1 in the prefrontal, 5 in the neocortex. Anything else you'd want to share around that?
Well, I mean, the goal of the project is basically to hack the spinal cord.
Okay.
A qualifier for my involvement is the fact that I have a spinal cord injury as a result of a diving accident when I was a young and dumb kid.
Right.
And so the thinking about restoring function in the spinal cord, which quite frankly is something that I never even allowed myself to entertain the idea, throughout most of my life. I just thought it was ridiculous. We would never get there.
Yep.
But it's a state now where research into ways to hack the spinal cord are very legitimate. And while I don't expect this to produce any functional changes in myself, I certainly do expect that, the young, dumb kids of the future
Yeah.
will have, a way to restore functions, if
Yeah.
they're unfortunate enough to break their neck. So to get back to the array placement, because the focus is on spinal cord restoration, there's 2 arrays in the sensory cortex, and there's 1 array in the motor cortex. And then there are 2 other arrays. One, the supramarginal gyrus, which is more of an association around the motor areas that integrate motor with other higher level functions. And then there's one in the anterior inferior parietal, which is posterior. And that's where a lot of association happen there. So the sum total of this is that, I'm really getting a nice representation of kind of the symphony that is, my brain. Granted, there's just like little microphones, teeny tiny microphones in these 6 different areas. But it's really fun. Bless what we can pick up with this.
Sure. So one quick question. So the audience probably is, at least somewhat familiar with BCIs, so brain computer interfaces. Now, what you're discussing is the concept of spinal computer interfaces. Are those technically different arrays, or are they the same? What does that look like?
The brain, the interface in the brain
Sure.
is the same.
Okay.
And what they're primarily interested in is, picking up the sensory. So like, you know, and I should add that these are not just read electrodes, but they
Right.
also can write. They,
Yes.
they can be stimulated
Hmm.
small amounts of electrical current
Right.
directly into my brain to activate neurons.
Yeah.
So when that happens, I get sensations like in my hands, in parts of my hands that I haven't
Wow.
sensed in 50 years.
Wow. That's amazing.
And, it's a combination of, detecting
Hmm.
where, how they can pick up sensation and motor, but then also how they can deliver it. Ultimately, it will take some way of getting through the break
Hmm.
in the spinal cord. There are some efforts being made to actually put another array
Right.
below the break,
Yeah.
as you were referring to with spinal cord arrays. And that research is coming along. There's been some
Right.
really amazing.
Incredible. And
Yeah.
you're one of the first humans to be able to actually have excitation in the prefrontal, correct? I
Oh,
mean, that level of research.
yeah.
Yeah. You're pioneering, the way here, both for spinal computer interfaces as well as brain. And it's
Yeah.
very altruistic, Galen. I mean, you're doing this really for the future of science. And,
Yeah.
it's very admirable and something
Yeah.
I hold you
Yeah.
in high regard.
Thank you. If I
Very, very cool.
give an example of kind of how
Sure.
out there this is, we've been very systematically working through stimulation of a brain region. I won't mention it, but
Um,
the uh, interesting part is about this is that the way it's tested, there'll be a dot for a second on the computer screen, then it'll go away. Then the dot comes back on for another second. During one of those times, the stimulation will be on, but just one of them. My task is to tell them if the stimulation was on or not. And there are certain electrodes where I am consistently right in telling them, that the stimulation is occurring. But when they ask or when I try to identify percepts that I actually sense as being different, I can't, I can't say why. It's like, my brain knows it's there, but it doesn't understand what it is yet. So our thinking is that with repetition, my brain is going to learn how to interpret that and understand exactly what's happening. If
right.
it's a sensation, if it's a feeling, what is it? I mean, it's reliable. It's like freakishly accurate, but it's like what? And that's
So cool.
that's the level of lack of knowledge we have about the brain. Uh,
Right.
but it also speaks to the opportunity that we have, you know, with this BCI to
Yep.
figure out some really fundamental things about brain functioning. So
So incredible. And this is all with Caltech's Chen brain machine interface center, right? That's where these
Correct.
clinical trials are happening today. Cool. Yeah, I visited you a couple times.
Yeah.
And, it's actually seeing the photos. Remember when you went through the surgery and, a couple months later, I saw the photos at Caltech and, a huge chunk of your skull was completely removed. And then actually seeing these neural arrays, they're not like nice little pieces of candy. They are,
Yeah.
each array is what, 8 by 8? So you have 64 nodes times 6, and they're pretty poignant, so to
Yeah.
speak. And yeah,
Yeah.
it's pretty amazing when you see the wires, and then you have each of the two going out of the 3 PEDs, right, in your skull. And
Yep.
then you actually get connected to the internet, or at least to the
Yeah.
computers. But
Yeah.
the internet, it's just so fascinating. And you have, of course, invasive BCI and then non-invasive BCI, and such amazing research that's happening really in both areas, and the future of Neuralink, where everyone gets chipped. It's certainly possible, but I'm also very interested in the short term non-invasive BCI work, where quite literally people are typing. It's taking their brain signals and then actually helping them finish emails and things of that nature.
Yeah.
And it's happening right now. We're very much on the cutting edge of of this research, and you're really leading the way. So very, very cool. Do you want to talk a bit about your the integration of neural signals and then robotics and some of the trials I've seen you do, but where you're actually using your brain to control robotic arms as an
Yeah.
example?
Yeah. Again, there's a motor component to this. So, there's an array in M1, and as Thoryn said, goes into the cloud, so to speak. But those signals from my neurons firing are decoded and fed into a avatar of a hand with fingers. And with trials, I've been able to learn how to just think and move that hand, move the fingers. And that's pretty freakish experience to just be thinking about moving fingers and seeing them move, because I can't do that. But yet, after 50 years of, being a quad, never using those particular, neurons, at least in a functional way, now seeing them still working. The researchers actually didn't know if those areas of my brain that control, finger movement,
Yeah.
would even be organized in a way that would allow for movement. So that was pretty amazing to realize that even after 50 years, the brain has maintained kind of the functional organization that's required to do something as specific as move fingers.
Or an entire robotic exoskeleton, or who knows down the road. It's
Exactly.
robotic fingers now, but
Yeah.
where this could go.
Yeah. I've always said I'm not stopping until I get
Awesome.
an arm that can pick up like 400 pounds. I want to be a stonemason, man.
It's certainly possible. If anyone can do it, I believe it's you, Galen. That is so awesome. What do you envision the evolution of BCIs looking like?
I think it's going to be integration between the brain and the digital technology. I think there will be complete integration. I think the ability to upload, so to speak,
Yeah,
are
sure.
functioning.
And so for the audience, this is similar to like in The Matrix when, Neo was learning jujitsu and he pressed a button and he literally learned jujitsu. So most of the research is outward bound. You're controlling something, but then to your point, the future could be very much in the ability to download things and then actually use them in the neural framework.
Exactly. And I think all of that is in the future. It's not tomorrow.
Yep.
There's a lot of work to be done, and but it's well underway. And I think from my understanding of the research, it's really seems to be hitting that hockey stick time of exponential growth. So
Absolutely.
we don't know
Yeah,
how quickly it'll move, but
definitely getting the visibility and the funding that it may not have in the past. And
yeah,
very, very exciting from that perspective. Do you see any future ethical concerns? Is there anything on the horizon, that you're personally looking out for? I know you're a part of an organization of other BCI,
yeah,
users.
yeah,
Anything you guys are talking about, or what do you think is maybe
very,
kind of the negative side of this?
very much. I think there are ethical concerns, not right now.
Yeah,
And, I kind of am experiencing them myself. As you may know, I wanted to access the sounds of my brain for
sure.
this um, killer's uh, music track that I've been working on with this
Right. I can't wait to hear
brilliant,
about that.
brilliant
Yeah.
musician.
Awesome.
But
But you
they,
didn't have access to the data.
they
So
would
that's
not give me the
yeah.
data. And that was really disquieting
Yeah.
of, episode to know that this is my brain, but it's not my data, that I
Right.
can't have access to my very thoughts, my
Mm-hmm.
very neuronal activations. So that is, I've been working with the BCI Pioneers, which is a collective of 7 or 8 of us that are currently implanted. And we've been working with a lawyer from Cooley who's
Mm-hmm.
working with us pro bono to develop what we see as an ethical consent form
Yeah.
for future implantees. That can't stand. Uh,
Yeah.
my brain, my data. Um,
Certainly uncharted territories. And it really, yeah, I think there's a lot of implications there from informed consent and, data ownership. And, we are the first generation to really see that integration of biology with machines. And you are leading that charge, Dr. Galen. And myself as a data scientist, what I saw, through the 2010s and so forth with the, rise of social was, the fact that we gave away all of our behavioral data. And, we did that with the, guys that we were connecting with our friends from childhood and high school. But really, in actuality, we were giving, these major corporations all of our behavioral signals, fundamentally. And, there is a fear that, big tech is coming after brain data. I don't know, it's not totally unfounded, but obviously it is one of the the final frontiers. And you with your clinical trial and you and your team of the BCI pioneers are really leading the charge here. So it's awesome work. And yeah, anyway we can support,
yeah.
love to help. Cool. And then let's shift gears for a second. I think again you're such a pioneer, Galen. It's really amazing to have known you as long as I have, both in the AI front, both within BCI. And as I've gotten to know you over these years, I've seen your expression to the world be science, and also music. And I would like to go on record and say you're the most punk rock human on the planet, actually. And, as I've got to know you again, your expression, you have science, you have music, but specifically punk rock and now BCI.
Mhm.
And, we have a connection in punk rock. I've also been a musician my whole life. We both kind of have that right and left side of our brains, working in unison, both science and art and in music. And, I'm so excited. We have just wrapped up a punk track together called Domino. It actually is going to be the intro of the podcast, as a side note. And Even more excited to get this out to the world. Looking at early May, I think is the timing we'll be releasing the track together. And further, the most fascinating thing of this whole journey with you in recording Domino is that idea that you are literally singing, with a microphone, and then on the other side of the coin, using your BCIs to actually trigger synthesizers or MIDI or, a musical instrument, which is what we did in Domino. But I'd love to hear, more about your expression through music, and then ultimately the kind of the culmination here that we have with BCI. It's just so cool.
Yeah. Well, yeah, we do share a complete passion for music and the creation of music. There's something about that experience that, does things for the brain that, I think everyone should be doing. There's nothing like, like working with you in the studio, and
Oh,
after
so much fun.
yeah, after a session, it's just like, it's just in a flow state, and yeah, it's a gorgeous state of mind. But punk for me has also been, kind of just a identity, formation, young, stumbling into LA from, the farms of Pennsylvania, and, not feeling that much agency, and then all
Hmm.
running into this music where it's like, hey, you you get the agency that you establish, and take it, and that's that just earthiness of punk has been so important to me. And yeah, I really enjoyed the track. I think you've done a brilliant job with it, and I can't wait to
We'll
the
be unveiling this to the world soon enough, May, and just in time for summer. So,
yeah,
but yeah,
yeah,
really such an honor and such an amazing experience recording with you and composing with you, and being in the studio in Silver Lake. Yeah,
yeah.
very, very, very cool. Well, awesome, Galen. Well, we're very excited about that, and all the work that you're doing. One other point, actually, I just wanted to, let's see if I can share my screen. I wanted to share the post BCI protocol that you pulled together. I think this is, very, very prolific, and
Yeah.
this is a series of behavioral, lifestyle, nutritional, and movements, that we pulled together after
Mhm.
your BCI surgery. Arguably the first BCI protocol in history, or at least one of them. But, this is a really cool way for the audience to get to know you better. And, I think your perspective on this is just it's so inspirational. The fact that you have, taken control of this, and you're really giving back to future generations, both from your immediate research and then just the support at Brain One. It's something we really appreciate, and it's very altruistic, and
Yeah.
appreciate you as a human and a scientist, and also as a the original cyberpunk rock star.
Oh, thank you. But I just a word about Brain One. Um,
Sure.
the concept of Brain One is just phenomenal, world changing, because I mean we exist as, we have this amazing mind, but one of the most amazing things about it is that um, we can use it to make our body better.
Hmm.
It's kind of like if a computer were able to update its hardware, not just its program, but its hardware. I mean, that's literally what Brain One opens up for people in a very systematic way, and it's also a very scientifically valid way. I mean, we're kind of structured, at least, my tangent on the science of everything is,
Sure.
we the most important thing is our brains control our regulatory systems. And to do that, we need to build up our bodies, build up our internal systems, and we need to build up our brains. And we can only do that together. And I think Brain One is a way of taking care of our body and making our bodies better, while in a way that's consistent with how our brain works. Our
Awesome.
brain has a lot of biases in it and is not
Sure.
good at a lot of the ways that people have tried to, optimize their brain. And I think Brain One is revolutionary in that context too.
Oh, well, thank you, Galen. We really appreciate that. And the vision is that humans can become healthier with health protocols, structured frameworks that they can follow. And I mean, there was just another report that came out today. 40% of global dementia cases can be preventable. And generally, that goes back to the Lancet 2020 study. This is based on what are called modifiable risk factors, behavioral modifications. And, many of these things, like music is a great example of a way to continue to excite your brain. And so it's a massive challenge, and it's only as the aging population continues, we definitely need better tools. And so our vision is to give away a protocol to help people ultimately prevent dementia. And even if you have a genetic predisposition to Alzheimer's, there's different mechanisms you can start to stave off the development of amyloids and tau and so forth in the progression of the disease. And so that's really where we're focused. And but really appreciate your words and your research, and we're very excited to have you a part of Brain One, and ultimately where we're going. So thank you so much.
My pleasure, my honor.
Awesome. And thank you for the time today. Really appreciate it. Hope to have you back in the near future to talk about the developments.
Yeah.
It's evolving so rapidly,
Yes.
and almost on a daily, weekly basis, both on the data side as well as just the evolution of the tech, invasive, non-invasive, and very excited about the direction. And you are truly a pioneer, leading the charge here. So we all thank you greatly. Thank you for sharing your background, and very excited to release this song with you in the coming months.
Yeah. Watch
All
out.
right, Galen. Well, thank you so much, and we appreciate it. Thank you, everyone. Take care.